That nice introduction, and thanks everybody for joining us today. Um, I want to start out by saying I know that some of my own colleagues from Marshfield are here on the phone, and so what I'm sharing are things that we talk about a lot back in our offices and information that I really depend on our team at our Children's Center to help with a lot of the content that you're going to hear today, and certainly a lot of the strategies that you're going to hear about. So when Philip asked for this presentation, I said, I've been doing this for a long time. Do you want something specific or do you want a broad stroke? And he suggested, because this is an area that they don't discuss too often in the Florida area, that we just do a broad scope. So that's kind of what you're going to get today. So we'll go to the next slide, and I'll just explain. I got a little arrow there showing Marshfield is in the center of Wisconsin, and we are the federally funded center, the one and only center that focuses just on one topic. We have a separate funding stream from the 11 other regional or 12 other, 11 other regional centers, of which you have one of them in Gainesville. So we are the longest standing program on children and agricultural safety and health. And we have a wonderful dedicated staff that has our scientists, our research specialists, technical staff, and then we have the base support of systems from within the medical complex. So we're not at a university like some of you are, but we do have a very large rural medical complex that we are affiliated with. In the next slide, I'm going to just share with you what we want to do today is just kind of give you the big picture. And then with our Q&A time at the end, we can get into some details that might be of interest to you. So just a little background on the national initiative that started in 1990, well, started quite a few years ago. We'll talk about the scope of the problem nationally, and I'm fortunate to have some Florida data to share with you, and then just briefly go over some of the basic principles of childhood egg injury prevention, which is at times different than how we address issues for the adult population. Then we'll look at evidence-based strategies and resources, gaps and challenges, and some next steps. And next slide. So you see here, the patient goes to the doctor, and the doctor has all these diplomas on the back wall, and yet he says there's so little we know. And what I'm going to share with you today is some facts, some scientific evidence. Sometimes it makes sense, sometimes it doesn't really apply. And then there's a lot of perspectives on what's going on out there, because agriculture is a big topic. Children, pediatrics is a big topic. And then when you've been around as long as I have, you have a lot of opinions about what things mean. But I think in one thing we don't spend time talking about is agriculture as a whole, how important it is to our industry, I mean, as an industry, to our well-being, and how it can be just a wonderful place for children to grow up. And yet today we're talking about when things go wrong and children are injured. So you'll hear some evidence, you'll hear some perspectives, and some opinions that have been formed over time. And the next slide. So I want to step back to how this really began. And there was this landmark article in 1987 from Cheryl Tevis in Successful Farming magazine with this broad headline or bold headline that said, "We kill too many farm kids." And inside the story just went on about, different kids who've been killed and how it happened. And it was a big eye opener, and it really sent shockwaves to the farming community. And back in that time, we thought there were about 300 children who were dying on farms each year, and about 300,000 who were seriously injured. But we really didn't know for sure. We just knew it was a problem that nobody had been looking at, or not seriously. Next slide. We'll talk about, so where did things go? At that time, we realized we had very little data, and certainly no national kind of numbers on what was going on. And at the same time, we knew that there were these very limited regulations for youth working, and the child labor regulations were outdated, which they still are outdated. We have this thing about agricultural norms and in farming communities where it was thought, well, it just happens, kids die on farms, and we expect it to happen now and then. And then this issue of children and farm safety really fell between the cracks of different federal agencies. Nobody was in charge. So Maternal Child Health Bureau looked at kids in general. OSHA and NIOSH looked at kids who are working, but nobody was looking at kids who live and grow up on farms. And at that time when I started, there weren't any like safety resources, no booklets or a few coloring books or things for farm safety, but no real evidence of what works. And at the same time, we have, and Captain Dixon is, I think, on the call, who's really promoted this concept, the farm kid paradox of the benefits and the risks, and what's more important, and how do you balance out the risks of growing up on a farm with the real and potential benefits. So these were all going on, and it was like, so where do we go from here? So next slide. So in 1992, we hosted a symposium with 100 invited people to come in and look at the problem from 9 different perspectives. Are you a parent? Are you an educator, a sociologist? You know, what's the scope of the problem? And that was really the beginning of developing a body of knowledge on children and farm safety. In 1995, a committee was formed to plan and set out a national action plan that addressed leadership, surveillance, education, training, public policy, this type of thing. The plan then was presented and signed on to by 80 different organizations, including American Farm Bureau Federation, American Medical Association, many large organizations that signed on in principle that they agreed with the plan. It was taken to NIOSH. NIOSH said, you give us the money, we'll take charge, and we will get this initiative rolling for sure. So that's what happened in 1996. The US Congress allocated $5 million a year to launch the plan, and that was really the beginning of this initiative. And then it actually launched funding for a National Center of Excellence, which currently we are the holder. We have been the holder of that, and it goes up for competitive renewal every 5 years. Next slide. So what do we know from the data? So one of the sad things is we had a nice picture going from 2001 to 2014, where telephone surveys were conducted on farms across the country, and we got prevalence and incidence of different types of injuries. This graph here shows on the red line are all injuries, whether they're kids who live on the farm or work on the farm or visit on the farm. And the green line shows the children who live on a farm. So you can see the difference between those. But in general, we can see that about 2012, things were starting to level off. And as far as we know, they've leveled off and maybe have dropped a little bit. But that was a good decline in terms of the initial span of national data surveillance. And these are non-fatal injuries to youth. And that data is still out there. You can look it up by state or by type of injury. And on our next slide, we'll talk about deaths. And this slide depicts children who are adolescents who are working in agriculture, age 15 to 17. So they're employed to work in agriculture. The red line across the bottom is all industries except agriculture. The blue line is agriculture. So what it tells us is that if your teenager is going to be working in agriculture, they're about 7 to 8 times more likely to be killed on the job than their friends who are not working in agriculture. So that again is a type of data that sometimes we get it, sometimes we don't, but it's spotty at best. But on the next slide, I'm going to show you that there is a timely data source housed actually here in Marshfield. It's aginjurynews.org. It's a free service. It's a collection of publicly available reports harvested from like Google searches and meltwater searches, different ways that they get that. Sometimes the news is just sent in from someone who's aware of it. There's over 4,000 reports that are uploaded starting in 2016 and up to keep up to date with it within like the last few months. Over 1,000 subscribers from 54 countries. And again, this is free. You can just log on and request entry into the system. And the most recent publication on analysis of this just came out in 2020, November of 2022. And it showed that of the news that's picked up, which keep in mind, it's more likely to be a death that makes it to the news. There were 548 youth under 18 years. Most of these in the news were, or half of them were fatal. And here by the age, you can see 55% were younger than 10 years. 75% were males, 77% transportation related. And not surprisingly, the leading agents of these are tractors, ATVs, skid steers. So some kind of transportation or machinery that's used to transport materials. Highest numbers, Wisconsin, Iowa, Pennsylvania, Florida, not so much, but we'll go over that in a bit. And most common months are November, October, which is harvest time, and July, which is summertime. So again, you can ask for alerts from the system if you're interested just in tractor incidents or your state or, by age, they can filter those out for you, and you can ask for special alerts coming your way. So you can tell by this that by the ages, that oftentimes these are not working youth. They're young children who are in a hazardous work environment. Next slide. Let's talk a little bit about Florida. And I'm grateful for Dr. Sarap Garucho from Florida. I hope she's on and she'll be available for questions at the end. Sarap has provided this information that she gets from the Florida Vital Statistics, and she's very active in setting up and managing the egg injury news system here in Marshfield. Her data showed over the 11-year period from 2010 to 2021, there were 25 recorded deaths of youth in Florida. You can see here that 40% of them were 6 years or younger, and 84% of them were 12 years or younger. So most likely not working when they were killed on the farm. 70% are males. Major sources of trauma are ATVs and tractors. And it's unique in Florida to be working in agriculture or to be exposed to agricultural hazards, because where you are, you're year-round outdoors, and that's very much in contrast to some of the Midwest and other states where kids would be working in barns or sheds during part of the time. So it seems that the health risks to young people in Florida are much greater than the injury risks. And I've just listed some of those here, and you're very familiar, I'm sure, with heat-related exposure, heat-related illness, excessive sun exposure and pesticides, air pollution from things such as wildfire smoke, pests, muscle strain, mental health issues, that type of thing. So I would encourage you to contact Sarap if you are aware of deaths, to make sure that they're in her database, and if you have questions about specific numbers that you have. And on the next slide, I'm just going to show you a few of what these Florida cases were. I'm just listed here. A 3-year-old jumps out of the back of a truck and gets run over by a trailer that's towing sod. 4-year-old struck by a tractor. 5-year-old on an ATV. A 5-year-old kicked in the head by a horse. An 8-year-old non-helmeted on an ATV that rolled over. A 9-year-old bicyclist collides with a farm equipment. And 10-year-old is run over by a tractor wheel. 12-year-old ATV passengers crushed, and then 17-year-old fell from a fishing boat and drowned. So these are actual cases from Sarap's collection of Florida cases. And when I look at those, the question that comes to my mind is, who was the adult responsible for that child? Who's in charge? Because the child is not responsible for their own safety in these situations. You have to always turn it back to, is it the parent? Is it the employer? Is it the big brother who was in charge? Were kids goofing off, or were they working? And in the end, it comes down to adult responsibility. So let's go to the next slide. And I want to talk about just some of the basic principles that we're dealing with here. Child development is a huge issue, so I'm not going to go into it, but there's just 5 basic principles depending on which theory you're using. And we look at the physical development and growth of a child's body and muscles and senses, which is not based on age, it's just based on, their physiology. Then we look at the social development, which is how they relate and play and talk to others. Their emotional development, which is their awareness of self, how they express themselves, how they care for themselves, and then their cognitive ability to think and reason, solve problems, anticipate problems, and then understand situations, and then their ability to communicate as language. So depending on what theory you have, there's a lot of subsets to all of this. And what I wanted to point out is that with the resources that are available that you want to target for a certain population, you really need to integrate some of these principles into them. And excuse me, we have these voluntary guidelines, egg youth work guidelines, that are based on child development principles. And it will ask the question, can your child anticipate, if it's bad weather coming, or can your child anticipate this? Or are they able to communicate appropriately if something goes wrong? And it poses those questions to the adult to help them match, is this work a right fit for the child? And there are some ages listed in there, but they're for reference only, so that people really think, is my child ready to do this job safely before they assign the work to a youth? Okay, we'll go to the next slide. I know we've all had it drilled into our head to not use the word accidents, but it still happens. And I just want to emphasize that child firearm injuries and fatalities are never accidents. And we accidentally use the term sometimes, and it's okay if that's the way the general public understands it. But we're really trying to work with the press and fellow safety professionals to minimize or eliminate the use of the word accidents for a number of reasons. And we do have commentary available. I think either check with our office or check with Philip that explains the background for the change in terminology and the rationale for not using it. And in my own experience, we're finding that situations are not investigated or checked, and people don't necessarily rectify an unsafe situation because they're thinking of it as an accident. And it's sort of a cop-out when you think of it. And we really want to eliminate that option for people just to pass off an unsafe situation as saying it was just an accident. Okay, a few more principles we want to share with you. In the occupational safety world, you hear a lot, and you use a hierarchy of controls, which is really important for protecting children. So the highest and most effective principle is elimination. And for us, when you think of most of the children who are injured and killed on farms are not working, the logical solution is to eliminate them from the work environment. Either get them off the work site completely or have some kind of a barrier, that type of thing. And then this hierarchy just kind of rolls on through, down the road to personal protective equipment, which is still really important if the child is working and going to be exposed to hazards. The next principle is the socio-ecological model, or SEM. And this is widely used in the public health world, and we modified this specifically for children in agriculture. So if you look at the core in the center, at the bottom, that's the child who lives or works on a farm. And that child is really dependent on an adult in their immediate environment to safeguard them from hazards. So it's the child who then bears that next level of response, or the adult who bears that next level of responsibility for the child. And then we go up the scale on the socio-ecologic model of interpersonal interactions in the community and where they're involved, what institutions are in a situation to protect children, and then what's the public policy or organization policy that would safeguard the child. So the further out you go, the greater impact it can have. And then in the end, the solution is sort of this mix and interplay and constant reinforcement of the different layers of the socio-ecologic model. So we'll go to the next slide. So I'm going to go through strategies based on that model, and we'll start out with that outer ring of public policy. So we talk about U.S. child labor laws and policies. We know that they're outdated. We know that they're less restrictive than international standards. And there's a lot of information out there, and the Department of Labor has everything posted out there, and each state has their own level of continuation of the federal orders, or possibly a bit more strict. So the FLSA and the hazardous occupation orders differ between ag and non-agriculture. And in ag, they're generally weaker, less strict than they are for the non-ag situations. Another public policy that we had been really hopeful to have an impact is the 2025 Farm Bill, which is still under construction, and hopefully will move forward. Two strategies that are included in there is childcare support for ideally off-farm childcare, and Lawrence Biko from now at Penn State has been very active in promoting different bills that would actually provide funding for rural childcare programs. And then support for rollover protective structures is another area that's been introduced into the Farm Bill, or hopefully will get federal funding, and that's being pushed by our colleagues at the Northeast Center up in Cooperstown, New York. So hopefully those things would come through as public policy that then trickles down and has an impact on the safety of children in agriculture. Another interest, we'll go back to that previous slide. I want to talk a bit about state actions to weaken child labor laws, because that's really a hot topic issue now. And getting a lot of questions about that. And we hear that industry is driving to allow kids to work longer hours and have more exposures. I would say we have, as of this month, there are 28 states that have introduced some type of legislation to weaken the child labor laws. And there are 10 states that have actually enacted certain laws that allow children to work longer hours, work weekends, maybe work alone, maybe work with some hazardous equipment. At the same time, we're starting to see a few other states that are taking the reverse strategy and trying to strengthen their child labor laws. So we're seeing the New York Times did a series of articles about this. It's been in different agricultural press, and we're seeing that a lot of this is tied into, the declining labor force, the importance of earning money for some children, especially for immigrant families. And it's a really interesting topic to watch, because really people had not been paying attention to it for a long time. And then the last thing on this slide that I wanted to point out is an area of my own research with our team. We call it our legal project, looking at what happens when a child is injured or killed on a farm and there's gross negligence, and what happens if the local law enforcement agency presses charges, and there are criminal charges. And we found that over the course of 6 years, there were 457 potential cases where it would have been considered gross negligence, but only 12 times were there charges actually filed against the adult. And it was done primarily to change the environment on the farm so that the other children on the farm were not subjected to this type of unsafe practices. So some of those cases were just basic goofing off with kids in a tractor, or just absolutely not paying attention and putting them in really dangerous situations. So I think that this is another area that's been mainly overlooked, And our interviews with law enforcement were very interesting because they explained to us, when we say, why are not more of these investigated? And they said, because the first responder said it was an accident. And if it's an accident, it's an accident. And then unless somebody challenges that and said, no, it wasn't an accident, they said unless it's challenged, they just ignore it. So then that means Child Protective Services does not get involved, and they just let the situation continue. And there's been some of these cases where children are being asked to do really dangerous things over and over, and that's the type of situation where we'd like to see more involvement of the local authorities to say, let's safeguard these children so it doesn't happen again on the same farm. Okay, now we'll move on to the next strategy, which is again policy, but this is at a different level, organizational policy or voluntary policies. And we really should and hope to involve agricultural businesses much more at this level in terms of their policies, their standards, their kind of safety audits that they do, which some of the big box companies obviously set their requirements for international trade and domestic trade, and for anybody that's sort of in the vertical chain of providing supplies or supplying, for example, products, milk, fruits and vegetables to some of these bigger corporations. So we expect them to set policies about children in the work environment, or ages of people working. And for the most part, it's my belief they're trying to use these corporate social responsibility principles. They want the consumers to be happy. They believe it's the right thing to do, and they really don't want to put children in harm's way. So we hope, for the most part, that those are the guiding principles for big businesses. And I would refer to the Agricultural Safety and Health Council of America, which has been around for 17 years now. And if there's questions about that, or questions how to work with, the fruit growers in our area or another organization, you can make those connections through the leadership at ASHCA. The other thing that businesses can do is provide funding and sponsorship for safety events or safety materials, that type of thing. And many of the big businesses have their own corporate giving arm that you can turn to, and especially if it's kids, you'll be surprised. They're willing to provide some funding for your work. Other policies should come from farm and youth serving organizations. The big farm organizations have their state, their local chapters, and many of them have their own safety person or safety committees that look at what are the local issues that are going on. And these organizations can also be offering endorsements, promoting safety resources, participating in public service campaigns, and hosting farm safety events. So again, we're looking at that outer layer of the socio-ecologic model, where activities happening at this level can really filter down and have a strong impact on what happens to children. The next strategy we'll look at is research, and just suggesting that it's really important that we continue to gather evidence and test things, and wherever possible, have the community involved in the participation of that research. And we know that to have strategies work, they really need to be targeted at specific populations. Sometimes that's the moms, or sometimes it's a certain community group or a certain cultural group. And then looking at specific topics. So the more specific the intervention and the topic, the easier it is to get the desired effect. And then really looking at identifying the root causes of unsafe practices. We talked about the risks versus the benefits and how people look at what kids are doing on the farm. We look at economic pressures. What else is going on? Are there childcare programs around? So sometimes it might seem like it's beyond the control of the parent or the community, but we still need to look at what's going on here so that we can address really what's going on, and not suggest that throwing an educational brochure out their way is going to help, because we know that that's one of the least effective strategies to use. And then really promoting this concept, we say R2P2R. What does the research show? Have people practice it out, hear back from the farming community or the agribusiness, like, okay, it sort of worked, but it didn't, so we need to do some more research on it. And there is a lot of published research. I'd say in the last 30 years, there's really been an explosion of funded research, either by NIOSH or USDA, a lot of publications out there. And I'll just point out to our newest endeavor, which was Frontiers in Public Health, which is open access online. And we had worked with a team of, I think, 8 editors and secured in the end, 29 peer-reviewed manuscripts, and some of them are commentaries from 8 different countries of what's going on here. So it's a really nice collection. It's easily accessible online, and I'd say about half of them are from the US and address a lot of different topics in terms of agriculture in the US and around the world. And then I also want to put in a plug for our Journal of Agro-Medicine, which is housed in the National Farm Medicine Center, which puts out special editions on different topics. And twice in the past, we've had dedicated to children. And the one that has just come out now is dedicated to farm injury surveillance. So lots of research out there that you can find. And any of the citations, if you see them here and you're looking for them, just check back with me and I'll help you get a hold of them. Okay. All right, let's move on to our next strategy, which is advocacy and then public service campaigns. And again, so we're coming down on the layers of the socio-ecologic model. So this is the layer where it's sort of the community and the environment starts to put pressure on taking a look at what's going on and how do we influence that culture of safety. And I'll point out the Childhood Agricultural Safety Network, run by Marcia Salzwedel at our center. And this is like an online community of, I think, over 180 individuals representing many organizations, mostly from North America and a few from Ireland. I'll put in a plug for Alma, and Australia and other places as well. So that's a nice place to share ideas, get information, find out who's got a resource that might work for you. And then just point out some of the campaigns that have occurred over the years. One is like keep kids off of tractors. And there's a lot of campaign brochures. A lot of materials are available in Spanish, some available also in French. We have media guidelines. So if your local newspaper has a cover picture that shows a child doing something unsafe on the farm and they're just talking about how great it is to, ride on the tractor with grandpa or something, talk to us and we'll help you, like have a response to that, like, okay, we gotta like challenge people for depicting things unsafely. My own favorite campaign, we call it Parent First, Farmer Second campaign. And it's like, I'm raising kids. I'm raising all these other things, but my first responsibility is to my kids. So I'm a parent first and I'm a farmer second. And again, there's a lot of different campaign posters and messages with some different images that can be used for that. So those are all available resources that people can adapt for their own purpose. So just on the next strategy I want to share with you, these resources, there's a website, cultivatesafety.org. It's run out of the Children's Center, and it has a whole, world of resources available for you. Things like voluntary guidelines for work, for play, for employing young people on farms, for working with your community to develop a child care center. So these are based on some of our basic principles. and widely available for like hired youth working or kids working on family farms, different resources that can be modified for your own use. Again, at that website that's free of charge. And then locally, you'll want to talk to your cooperative extension person. In Florida, you'll want to talk to a Surratt and other people locally in the businesses. The big agribusinesses all have their own risk management department with their own strategies specific to, are you harvesting tomatoes, or are there certain pesticides that are being used in your area, that these businesses would have risk managers that probably have their own safety resources that they use for their employees and could make them available to you as well. So I think we have to keep prompting the agribusiness, the employers, to help us, help the people in the community, and don't let them get off scot-free. We'll go to the next slide. So I want to share some success stories with you. We talked about the Childhood Egg Safety Network, which started with 3 people, and over the years it kept growing and moving along, and now it's just really exploding with great membership, great discussions, and great sharing of resources. We also know that up until the data that we had up until 2014 showed a 60% decline in non-fatal injuries. We think that that's continuing to decline, but we can't say for sure. And then CDC in 2010 announced the Child Egg Initiative as one of their top 10 public health success stories. So that was exciting to be recognized for some of the accomplishments that were made as people enacted this national action plan. Other successes that US, besides NIOSH, we have USDA and many other non-government organizations that are involved. There's more funding for research. There's more programs that are going on. And it's just very rewarding to see the issue being addressed in many states across the country. And then I wanted to point out, too, with the voluntary work guidelines that we talked about, previously known as NAGCAT, now they're known as AWIG for the acronym, that when they're used and when it's the right guideline for the right type of work the child is doing, that research has actually demonstrated it can cut the injuries by half. So those are some of the highlights of successes, but we still have some continuing challenges that I'm going to address on the next slide. Okay, so this is where we kind of get more into like this, okay, my perspective on things and where our gaps are. Number one, we really are lacking good, reliable data on a consistent basis. And I don't know the best way that we're going to address that. It's being discussed, but it's expensive. We have difficulty in reaching select populations. Some of them listed here, and there's others as well. But we know there's certain pockets where either the safety culture has not evolved, or people might feel that they lack the control over the situation. That's where we really want to add a greater emphasis in the future. I've also noted just this massive increase in the use of ATVs and this whole crisis of ATV injuries and utility vehicles used more and more for work. And sometimes at work is a little bit of recreation. So that's where we're never sure, were they working or just goofing off at work, or just running sandwich out to dad out in the field and hit a rock or something. So there's just a big increase in the use of those types of vehicles. And at least here in the Midwest, a big increase in the use of skid steers, which are smaller than tractors, easier to maneuver, but very dangerous for young people to be operating. We also know there's outdated child labor laws and limited accountability, and states that are, taking this up as a way to address their labor shortage. And then there's the whole issue of the economy and where's ag going, and they're really caught in the vicissitudes of public policy and global trade and climate and whatever is happening with the with the production of agricultural products has a huge impact on how does that impact the family, how does it impact the community, and that type of thing. And we've talked about the labor shortage. And one of the studies showed that young people are just less likely to want to work. They're able to stay in school longer, and that adds to their lack of availability for work. And then we have this whole issue of, what's a child's role on a farm? And we want them to grow up, we want them to appreciate agriculture, but we want them to be whole and complete and really have a respect for agriculture without being put at risk. And then something that which is not just limited to agriculture, but really nationwide is the limits that we have in terms of affordable and accessible and high quality childcare. Okay, so where should we go from here? I had listed out what I see as the next steps. First of all, facilitate the validation of injury data. Ideally, we'd get it at least once a decade. And then conduct research on the barriers and motivators in high-risk populations. We want to support the influencers, the farm organizations, the big agribusinesses to adopt and promote safety policies and protocols. And then encourage public and private funding for young parents and beginning farmers so they get started off the right way with the young children, and maybe it's a new farm, but get started out with the right principles. And then public policy to hold parents and employers accountable when they're negligent and allow kids to be in unsafe situations. And we talked about farm childcare being important to have public funding and employer support as well, and support immigration reform and enforcement of child labor regulations. And as I say here, we can all challenge unsafe traditions. That's up to us at the individual level when we see something to challenge it. And on the next slide is, one of our standard campaigns. We need to challenge those traditions because it's easier to bury the tradition than it is to bury a child. And this, again, is one of the public service campaigns that's available with a different image and available in Spanish as well. So I just want to acknowledge everyone. On the next slide, I want to acknowledge you all for, first of all, thanks for joining the webinar. And I want to acknowledge my colleagues back in Marshfield and all the people who do the great work, day-to-day work there for us, and acknowledge NIOSH for the funding that has really supported this work over the years. And our Children's Center is within the Marshfield Clinic Research Institute and within the National Farm Medicine Center. So people kind of just call us Marshfield sometimes. So I want to finish just by saying there is help out there. And on the next slide, my all-time favorite cartoon, yes, Lassie, get help. And so he's like, oh, sure, I guess I need some help. Well, there's a lot of help out there, and we don't want you to have to reinvent the wheel. You don't need to start anything from fresh. There's a lot of resources, some at our center, some at your local, at your NIOSH Egg Center, and certainly with your local community, the businesses, cooperative extension, that type of thing. So lots of help out there. Don't have to start from scratch. So I think I have just a last slide that we'll use to open this up for any questions or comments. So I'm happy to hear from you.
Well, thank you so much, Dr. Lee. That was an amazing presentation. To Dr. Lee's point, yes, if you have questions, if you have comments, you can use the chat or the Q&A. We have about 10 or 12 minutes or so left. One thing I will mention as we're getting into some questions is there were a lot of great resources shared in the chat as Dr. Lee was talking. Feel free to go into those. I'm also going to save the chat, and I can include some of those in our follow-up email that will go out to everyone that registered. So thank you for everyone who put those resources in the chat. We'll certainly send those around as well. There is one question, Barb, in the Q&A. I'll read it for you. Is there any research specific to farm worker children / children of farm workers? As many farm worker families live in very close live very close to agricultural fields and housing, more prone to pesticide exposure through drift, etc.
Uh, the answer is yes, there definitely is. There should be more, but there's a whole body of information out there. And I think it's really important that that be shared in terms of, uh, what are the exposures and how long do they last and what are the ages of the children, that type of thing. I also failed to mention about in the state of Florida, the RCMA, formerly Redlands Christian Migrant Association, which is like the model childcare program through Migrant Head Start, and it reaches beyond that. But they also have a lot of information for parents who's who work as farm workers and then coming back to pick up their kids at the end of the day at the child care center. And they're a great resource for especially those types of health exposures of farm worker families.
Great, thank you so much. Are there any other questions or so there's a question from Leslie here. Have you found any good resources for Amish populations?
So the answer is yes. And that's not my area of specialty. We have people on our staff, and we work closely with, for example, Kay Moyer of Pennsylvania, who works closely with that population. So there are some. I'm not clear on how much they've been tested for impact, but definitely check in with our center, and they'll get you in, either get you the resources or get you in touch with the people who have the best resources. And I would add that we know that that is one of the populations that has a high number of serious injuries because the children are obviously really close to the farm activities and uh, just seem sometimes just out of touch with how we would expect some of the safety features to be on a farm. Okay, and I can see Marcia has posted some of the resources available on the Cultivate Safety website. So thank you. So again, I would just encourage you to check the Cultivate Safety worksite, contact our center. And I think Sarap is on the call. I think I saw her name pop up. If you have questions about Florida specific data.
Yeah,
Oh,
Sarap, if you would like, if you have anything to share, I could promote you to panelist but I wanted to check with you first, so you can either give me a thumbs up or a yes in the chat, either way. All right, I will. I'm adding you right now. So yeah, Dr. Guruchu, with located here in Florida.
there she is.
The floor is yours if you'd like to share any.
Great.
Hello, Barb. Love, Liv. Thank you very much. It was a great presentation, Barb. Again, as Barb said, I'm happy to share my resources with anybody who is interested in. As Barb said, also, Ohio State has some Anabaptist related resources too. So you can look at their resources. Thank you.
And Sarap, was there anything in particular in terms of the data that you have in Florida that
Yeah,
you
the
highlight?
data right now with my PhD student, we are looking at electronic health records to dig into injuries and all the data. You know, this data is limited with the deaths from vital statistics, and they usually ask us like specific codes to we provide them, and they give us those codes related. If we are missing some of the codes, it might be related to agriculture. So it's we really don't know exactly how complete is our data.
Thank
Again,
you.
I'm happy to share with anybody. additionally, so I think we are not getting any more questions, but Progressive Agriculture Foundation, they have great, they are organizing youth safety days. They are not specific to like agriculture only, but they have also great resources. I'm contributing their efforts as a trainer for ATV safety, tractor safety, or any machinery related safety trainings too.
Right. Thanks for bringing that up, because Progressive Agriculture has been putting on their safety day events for many, many years and have really refined their process. And again, it can be a free, sort of free activity in the local community as well.